Welcome to Obesity Chronicles, a novel perspective. My name is Robert Kushner, and I'm a professor of medicine and medical education at Northwestern University Feinberg School of Medicine and director of the Center for Lifestyle Medicine at Northwestern Medicine in Chicago. This program is intended for healthcare professionals. The information presented in this podcast is aligned with the views and opinions of the speakers and is sponsored by Novo Nordisk. The speakers have been compensated by Novo Nordisk for their participation in this program. This podcast is not to be used as medical advice and is intended for educational purposes only. It is not approved for continuing medical education credits. In today's podcast titled Obesity Unveiled, a complex disease with associated comorbidities, we'll recognize obesity as a chronic progressive disease with underlying pathophysiology that increases the risk for various comorbidities, including cardiovascular disease or CVD. Also, highlight the residual CV risk in patients with obesity and established CVD. I am pleased to be joined today by Dr. Eden Miller and Dr. Jamie Amandos. Eden, could you introduce yourself, please, to the audience?
Hello, I'm Dr. Eden Miller. I'm a family practitioner by training. I have my board certification in diabetology and obesity medicine. I work with my physician husband at our family medicine specialty clinic in Bend, Oregon, diabetes and obesity care.
Hi, I'm Jamie Almandos. I'm Associate Professor of Medicine in the Division of Endocrinology at the University of Texas Southwestern Medical Center in Dallas, where I'm also Medical Director for the Weight Wellness Obesity Medicine Program.
Well, welcome, Eden and Jamie. So let's get started with talking about the obesity epidemic in the United States. Obesity prevalence in the U.S. has tripled since the 60s and is not projected to slow down anytime soon. The prevalence of obesity and related cardiovascular comorbidities are projected to continue increasing through 2050. One projection study, based on data from over 6 million adults, calculated that by 2030, nearly half of the adults in the U.S., 49%, are expected to have moderate obesity or a BMI between 30 to 35. The study also says that nearly 1 in 4 adults will have a BMI of 35 or higher. Women, non-Hispanic Black adults, and people with lower incomes are, unfortunately, likely to see the highest rates of severe obesity based on these projections. Not surprisingly, along with the increasing prevalence of obesity, the prevalence of cardiovascular disease, a leading cause of death for people with obesity, is also expected to continue to increase. The rate of obesity-related cardiovascular deaths has tripled from 1999 to 2020. This is a huge increase. So clearly, this is a trend worth exploring further, and that's what we are here to talk about today. It is widely recognized that obesity is a disease. Jamie, can you share your insights on the current level of understanding and appreciation of obesity as a disease among healthcare professionals and your patients?
Thanks, Bob. We're really at a point where, as a society, we can't continue to ignore obesity as a disease. In the past couple of years, clinicians and patients are starting to talk more about obesity as a disease, but not everyone's there yet. And unfortunately, there's still a lot of weight bias and misunderstanding that may stop patients from getting the appropriate care that they want and that they need.
Eden, how about your thoughts?
Yeah, I couldn't agree more. I'm really glad to see that we're having forums like this. We're bringing it top of mind and we're kind of busting myths. One of the things I just love to do with my counterparts, as you're aware of, Bob, is that we do the Obesity Summit for residents. We're really trying to get them to understand that this is a chronic disease with an underlying pathophysiology involving dysfunctional adipose tissue, which can also contribute to numerous other disease complexes. And I really think that identifying those at risk, those who have excess adiposity and obesity, and intervening has the potential to impact a variety of chronic medical conditions. And so I'm glad to see that we're really putting this top of line.
Wonderful. I could not agree more with both of your comments. So let's get started at the beginning. What makes obesity a disease? Jamie, do you want to take that one?
Sure, it's so important to dispel the myth that obesity is simply just about eating too much or not exercising enough. The eat less, move more approach to treating obesity doesn't always work either. It's not a personal failure, and it doesn't result simply from a lack of willpower. Obesity is a multifaceted disease that involves a complex interplay of environmental, genetic, and physiological factors. For example, environmental factors like the availability and consumption of highly processed foods, lack of opportunity for casual physical activity, stress, sleep deprivation, and even things like quitting smoking or certain medications can promote weight gain or make it challenging to lose weight. And then there's genetics. There are nearly 100 known genes linked to obesity. Genetics can influence how our environment affects our weight. For example, some people are more prone to accumulating fat when they consume excess calories. In terms of physiology, excessive caloric intake combined with sedentary lifestyle, particularly in individuals who have genetic and environmental predispositions to obesity, can lead to an increase in the size and number of fat cells known as adiposity, which is a pathological hallmark of obesity. As adiposity progresses, fat cells can become dysfunctional, creating a pro-inflammatory environment that affects multiple organ systems. And most of the patients I see have substantial complications related to their obesity, like type 2 diabetes, MASLD, and osteoarthritis, which can lead to long-term disability. So we're really seeing a lot of people in our medical center whose health progress is severely limited by their obesity.
Eden, what kind of impact does dysfunctional fat have on the body and on our patients?
Obesity impacts the entire body. It's associated with more than 200 weight-related comorbidities, including cardiovascular disease, certain pulmonary diseases, dyslipidemia, type 2 diabetes, and various forms of cancer. There was a study that analyzed the National Health and Nutrition Examination Survey data from nearly 9,000 patients between 2005 and 2014. And they found that of individuals aged 60 and older with obesity, 75% also had multiple concurrent chronic conditions.
That is a high number, Eden. How does that align with what you see in your own patient population?
Well, I see kids as well. And you know what? Adolescent obesity is a growing concern. And we're seeing quite a bit of referrals for these cases. This is a major health issue that can have lasting consequences. The American Academy of Pediatrics has rightly identified weight reduction as a priority, underscoring the importance of addressing this issue early on. Unfortunately, adolescent obesity often tracks into adulthood and can contribute to a growing obesity epidemic. While adolescent obesity is a serious concern, our discussion today is primarily focused on the adult population. As we have discussed earlier, obesity in adults is a chronic disease associated with numerous comorbidities. And it's essential any person that is in medicine should have the conversation about weight and weight-related health outcomes with their adult patients.
Jamie?
I couldn't agree more. It's so much more than just looking at traditional cardiometabolic risk factors. I believe it's also about addressing weight and health, and making sure that we support our patients who may also be living with weight bias and stigmatizing experiences within healthcare.
Jamie, what is your biggest concern for these patients, given the possibility of the complications and comorbidities that you and Eden just mentioned?
I think it's so important for us to talk about the cardiovascular risk for people living with obesity. CVD remains the number one cause of death amongst people living with obesity. A study that calculated the health effects of overweight and obesity in 68.5 million people across 195 countries over 25 years from 1990 to 2015 found that approximately 2/3 of the deaths related to obesity or overweight were due to cardiovascular disease. A separate study that analyzed NHANES data from 2003 to 2010 found that obesity reduces life expectancy with a greater impact on the number of healthy life years or the years lived before people develop another chronic disease, such as CVD. They found that having obesity leads to 2 to 4-fold greater reduction in healthy life years compared to total life years.
And how common is CVD among patients with obesity in your practice, Jamie?
I would say about 1/3 of our patients in our practice have cardiovascular disease at presentation, and this ranges from atherosclerotic cardiovascular disease to other complications.
Eden, how about your practice?
I would say it's similar. I treat a broader cohort of individuals because I have pediatric and adult patients. Most of my adolescent patients haven't gotten old enough yet to get cardiovascular disease. But by the same token, we're also seeing some adults who present with heart disease and obesity at a younger age. So it's about where they are at on the continuum, whether they have had preclinical cardiovascular disease or established cardiovascular disease.
Middle-aged adults with obesity had a higher risk of cardiovascular disease events than those with a normal BMI. Specifically, men with obesity had a 47% risk of cardiovascular disease events, while women had a 39% risk. And more than 80% of patients with cardiovascular disease have obesity or overweight. Obesity is a direct and indirect contributor to cardiometabolic disorders, including cardiovascular disease. Individuals with obesity are at a higher risk for cardiovascular diseases, independently of whether they have other comorbidities. Even without conditions like diabetes or high blood pressure, obesity alone increases the risk of cardiovascular disease. Essentially, obesity can increase the risk of developing cardiovascular disease. And the longer someone lives with obesity and the more severe it is, the higher the risk of developing cardiometabolic multimorbidities, including cardiovascular disease. Jamie, can you give us an overview of biological mechanisms through which obesity increases the risk of comorbidities that ultimately escalate cardiovascular risk?
Absolutely, Bob. As you mentioned earlier, a positive caloric balance where the body consumes more calories than it expends can contribute to dysfunctional adipose tissue. This imbalance, along with genetic, environmental, and individual physiological factors, can also contribute to excess energy storage in the form of fat. The accumulation of fat, or adiposity, isn't just about gaining weight. I mentioned before that it can lead to dysfunctional fat, which can have a negative health impact. The dysfunctional fat releases pro-inflammatory factors, free fatty acids, and other adipokines, which can negatively interact with various organs in the body. This process helps to promote oxidative stress by increasing levels of certain pro-inflammatory cytokines like TNF-alpha, interleukin-6, and interleukin-1 beta, while decreasing protective anti-inflammatory factors such as interleukin-10 and adiponectin. So obesity, which can be characterized by both adiposity and dysfunctional fat, leads to low-grade chronic systemic inflammation and increased oxidative stress. These conditions are interlinked, as inflammation often exacerbates oxidative stress, and oxidative stress can further promote inflammation.
And how can that translate into a higher risk for weight-related comorbidities and cardiovascular risk?
Both chronic inflammation and oxidative stress may contribute to the development of obesity-associated complications. These include insulin resistance, hypertension, type 2 diabetes, and dyslipidemia. As obesity progresses and adipose tissue dysfunction worsens, it may also lead to serious vascular issues, including endothelial dysfunction, vascular remodeling, and myocardial remodeling.
So obesity can increase CV risk directly via core pathology of dysfunctional adipose tissue and indirectly via worsening of comorbidities.
Exactly. So in people with obesity, dysfunctional adipose tissue, inflammation, and oxidative stress can contribute to the cardiovascular changes I just described and can increase the risk of developing CVD as well.
Now that we've outlined the interconnectedness between obesity and cardiovascular disease, let's talk about what we as clinicians can do about this increased cardiovascular risk in our patients with obesity. Eden, let me turn to you for this section. Is treatment with current CV standard of care therapy sufficient to completely address CV risk in patients with established CVD and obesity?
That's an excellent question. No, despite using evidence-based cardiovascular standard of care therapies that manage modifiable drivers of CV risk, such as blood pressure and cholesterol and blood glucose, adults with obesity with established cardiovascular disease may still face this residual cardiovascular risk.
In my opinion, there's a need for increased focus not only on patients' weight, but also on all these other aspects of their health.
Absolutely. I totally agree. One of the things I do when I address an individual in my office is to talk about their overall health in many aspects. So many times we can be so number driven based on weight, where we think that's just a number. Rather, it's looking at all those things that contribute to their excess adiposity, as well as their obesity related comorbidities. And I tell them I'm trying to design a holistic, comprehensive plan, trying to address all those things to ultimately do what? The aim is to create a personalized plan that supports long-term success.
Jamie, is that how you practice as well?
Absolutely. When working with patients, we prioritize setting realistic and measurable goals that address both weight loss and overall health. We focus on weight management while also ensuring that other health metrics, such as blood sugar and blood pressure, are also improving if needed. For example, if a patient has type 2 diabetes, we track their A1C levels. If they have high blood pressure, we monitor their blood pressure readings. I tell my patients that by addressing both weight loss and these associated health metrics, we can help substantially reduce the risk of cardiovascular disease.
So we're approaching the end of this podcast. I'd really like to hear from both of you, Eden and Jamie, in that order. Your final thoughts for those who are listening to this podcast.
Well, thanks so much, Bob, for including me. I really believe that educating our peers and our patients about the connection between obesity and cardiovascular risk is key. With my patients, I discuss the various risk factors associated with obesity and emphasize its independent role in increasing cardiovascular disease risk beyond other traditional factors. Ultimately, my goal is to empower my patients to make informed decisions about their health and take control of their obesity-related risk.
Jamie?
Thanks so much again for including me, Bob. I really agree that it's important for us to acknowledge that weight is not just a number on the scale and focus on how we can improve overall health by addressing comorbidities associated with obesity. Obesity places patients at a multitude of risks for cardiometabolic complications. So it's important for us to keep weight and health top of mind as we work together as a team to treat obesity as a chronic and complex disease.
Thank you both so much for a great discussion. This concludes this episode of Obesity Unveiled, a complex disease with associated comorbidities. Please join us for the next episode of Obesity Chronicles, A Novel Perspective. For more information, please visit rethinkobesity.com.